Now, there were 766 new cases yesterday. All of them are locally acquired. That brings us to a total of 6,666 active cases across Victoria. I'm sad to have to confirm that a man in his 80s from Moreland, a man in his 70s from Hume, a man in his 80s from Hume, and a woman in her 90s from Hume have all passed away. I extend on behalf of the government and all Victorians our deepest sympathies and condolences to their families. This will be a very difficult time for them. There are 257 people that are currently in hospital with COVID-19. 60 are in intensive care and 41 are on a ventilator. We send our best wishes to each of those people and, of course, to the teams of dedicated professionals who are caring for them every hour of every day in very, very challenging circumstances. Of those cases, that is to say yesterday's cases, 81% were not vaccinated, 15% were partially vaccinated, and just 3% of people were fully vaccinated. There are 3% is actually a bit higher than it would normally be, and I think the Deputy Premier noted yesterday that there are a number of people who have come from aged care and have a number of underlying conditions. But even at that number, what the very clear pattern is, if you are fully vaccinated, you are far, far less likely to find yourself gravely unwell and in a hospital, let alone in a critical care bed or an intensive care bed. In terms of tests and vaccines, big day of testing yesterday, 62,408 results were received. Thanks to everybody who's gone and got tested. That's a fantastic turnout. The number's been very strong. It gives us a more complete picture, helps us to isolate and limit the spread of this virus. I know it's a process, it's a thing to go through, and we're very, very grateful for people doing that. And of course to the teams of people doing that testing work. 40,957, so just shy of 41,000 vaccines were administered in state hubs. Fantastic effort. People continue to turn up in very, very strong numbers, and that's why we're able to report today that we have moved to 75.2% of Victorians 16 and over have had at least one dose, and 45.6% of the Victorian community 16 and above have had both doses. They're fully vaccinated. Now, I have some announcements in relation to border permits. I know that the number of people who've been, in essence, trapped in New South Wales for a lengthy period, we have on numerous occasions sent our apologies to them and made it clear that we understand just how challenging it is and we wish things were a different way. Well, following advice from the Chief Health Officer, I can announce today that new rules will come into place from the 30th of September so that Victorians in an extreme risk zone, which is basically Sydney at this time, will be eligible to return home to Victoria if they are double vaccinated and if they have a negative test 72 hours prior to leaving New South Wales to return back to Victoria. They will have to do 14 days of quarantine, but that quarantine can be done at their home. If a person does not have a place to go to that's safe, well then we would try and make arrangements to support that person. But it's essentially home quarantine if you've double vaxxed and you've got a negative test within 3 days of coming home, then that all begins on the 30th, and those several thousand, we believe, those several thousand Victorians that are in Sydney that are from Melbourne or from Victoria will be able to return home. That's a big step forward. It's been, I know, a real inconvenience and a real challenge for those people and their families. And we've said so many times, and we've meant it every time, we don't want to have people locked out of their state, and we don't want people locked into their home. That's why vaccination's so important. That's why ending these lockdowns, getting people home, getting people open and free, having our economy function as it should, all of those things, they're all critically important, but they're only possible if we continue to drive these Pfizer, AstraZeneca and Moderna vaccinations up. And the good news is that's exactly what's occurring at clinics right across the whole state. Now, there will be rules, of course, that home quarantine is serious. It's not a matter of when you feel like it. It'll be proper, 14 days, and there'll be various mechanisms to check on people. It will not be technology enabled. We don't think we need to do that. We think, however, given the number of cases that are here, the number of cases that are in New South Wales, the growing vaccination numbers, and our proximity, if you like, to those first dose 70% double dose and 80% double dose, so the first and second double dose thresholds. This is a proportionate and the right thing to do. So I'm very pleased to be able to announce that today.